on using Big Day for pre-K. In our area, we have different sites use different curriculum. There's several different early childhood curriculums that they can choose from that are rated tier one. The one used most in our area is the Frog Street. But some providers also use, creative curriculum or other curriculums that, I think a lot of them also like the DIG curriculum. But those are the ones primarily used in our area. And we really like that, they have some choice in which ones they choose to use. We also provide some resource support to help them purchase curriculum if they need it. That's something that we do in our community network, our local leads program for our 5 parishes. So we try to make sure that everybody does have that and remove any barriers to purchasing curriculum.
Thank you both. There's a question, and I'll take this one. It's really about how might this or how might other initiatives fit into this model. I would say, yes, this is the big lens or framework, and all of the supports that we currently provide could be accessed by the local leads or by local programs. So I don't, we may review some of those things, and you all may determine at the local level that you need more of something or less of something, but I do see that support continuing. I see a question. Curriculum has been mentioned. Will the curriculum be the same choices we currently have? I will say this is not really a part of this call, and it might be a follow-up call that if you guys want to talk about curriculum, we actually are putting together a review committee to take a look at the curriculum in Arkansas. We have, I think, about 20 curriculums that are currently on the approved list. That's why putting your curriculum that you're using in your enterprise licensing system, which is part of the law requirement, is really critical so that we can get an assessment across the state of what everyone's using and see, what kind of rises to the top. We really want to work on having choices. We don't want to have one. So I can assure you that is not the goal of the Department of Ed and the Office of Early Childhood, but we may want to narrow to a smaller group to support you all with the curriculum and curriculum implementation. So that's sort of the work that we're looking at doing probably early in the spring. We're working on that. If any of you are really interested in that, have curriculum experience, would love to have you. And we definitely will be taking that out for opportunities to comment as we move that forward. But the current list of approved curriculums are still out there, and that's what you will use until such a time. And we would not flip that switch quickly. We would give you lots of lead time, like a year or 2 years, because we understand that curriculum is expensive. And if we limited it and you had to purchase a new one or you had to switch and make sure all your staff were trained, we understand the implication for that. So, and that's primarily for publicly funded programs. But we definitely want to focus on limiting that for support to you all as providers. I see individuals coming in and speak to us. Oh, and okay, thank you. Yes, these folks are here as partners. It's just acknowledgement that you all are friendly neighbors, and we really appreciate that in Arkansas. So thank you for noticing that. They're amazing. I've met a couple of them. I've been on a couple of Zoom calls with them, and they're amazing people, and what they're doing is really amazing. A question about, were any of the centers in the area quality, I'm going to say, are NAEYC accredited? Louisiana, states do things different in terms of quality, and I'm not real sure, and we don't want to get too far down in the weeds about what Louisiana was doing prior. This law change for them really tried to reorganize their state in a fashion to support quality. So, but were there any NAEYC accredited centers in Louisiana prior to this happening, or maybe even currently? Anybody know that?
I can say that I am aware of, so we have various type centers. We have, of course, the ones that accept public funding. We have those that don't. I know that there are a lot that don't currently accept public funding who are not in our network, who are NAEYC accredited. We also have some who are in our network who maintain their NAEYC accreditation. So being a part of the network or not does not determine whether or not you can maintain that accreditation.
Thank you, Lee. I mean, I think that definitely supported. And so we want to continue with programs in Arkansas currently. That is considered as a reciprocity for our Better Beginnings, because we appreciate those who have put that effort in already. I think there's a question about support, and I will say the Louisiana folks can talk about the support they're doing, but that may look different, and it looks different for Amy than it looks for Lee. If you haven't picked up on that nuance, they are working in unique communities, provide different things, but the overall goal is to support the providers in their geographical area. So there are lots of things that I can support with, but Amy and or Lee, if you guys can see the question from Kim Stinson, it's basically, does this support include enrollment resources, hiring, special needs such as forms, provider observation forms, tax support questions? Any of those things rise up as things you all have helped providers with in your area? Are you there?
Yeah, we're here. Sorry, we were both unmuting at the same time. So we just try to, if our providers have a question about any of those kinds of things, we always try to, if we don't know the answer, we work to try to find the answer for them so that they don't have to dig around and try to figure those things out. Now in Louisiana, we have offered workforce supports to help support bonuses for teachers, things like that. Through grants that we've written, that we had the opportunity to apply for. A lot of the resources and things that were mentioned in that are things that we can help provide support to. Even if it's something smaller, just like helping them post job openings and making sure that they are getting their workforce trained and providing the training and resources to help support them to get their teachers certified and such. Those are all things that we try to support as best we can to all of our providers in our areas that we serve. I'm not sure exactly in Leah's area, it may look a little different. Some things are offered because of grants that we write to try to provide additional support for our providers in our areas. And then some of it may be things that are coming down from the Department of Education to us that then we're able to utilize those resources for.
Ditto.
Thank you, Lee. I had a question about how you support family childcare. We have several hundred licensed family childcare providers in our state. They're a big part of our network of providing early care and education services. Many of them have gone through national accreditation in the past year or two. So how is that? Is that just part of your collective groups that you're working with in your area?
Yeah, so family childcare were just added. So what I love about how Louisiana is doing it, even though we've been doing this since 2014-ish, it's like a little bit is added every time. So we didn't start with everyone. We started with pre-K and toddler. Then they added an infant a couple years later. And now we've just had family childcare providers. There was a pilot first, and now that they're able to opt in or out of academic approval. So that opting in or out of academic approval is what makes them a part of our network. So once they opt into academic approval, then they have to do teaching strategies, goal checkpoints with all of their publicly funded babies. They also have to have observations with the accountability tool. How we treat them is the same as everyone else. We actually have a dedicated coach just for family providers, because that could look different. So the coach that we use for our family providers actually had a family site herself. So she understands that there's a mixture of ages. When we're looking at our grants, they are able to, if they're in academic approval in our network, and we have about 17 or 18 right now that have opted into our network. If they are in academic approval, then they are able to get the grants just like everyone else. They are able to participate in our professional development. So they have become a part of our team. And when they did their first observations and we got our first scores for them, they scored so high. We were like, you guys must have been doing this for a long, long time. So we just brought them in as a part of the network. And this is year 2 officially of them being in, and it has been great.
Thanks, Lee. Amy Campbell, I might take your question. I think I see several early intervention day treatment programs on the call, and I think this is really important. I will tell you at a really high level, the law says all publicly funded programs, are required to participate. And so because EIDT programs do receive public funding, I would say generally I would expect that to be the case. But I think the bigger question is, what does that mean for EIDT? How does that look? And I'll take that one and work with, I don't know if Danita Pitts is on here, but we'll take that one and maybe reach back out to the early intervention world and provide some clarification or any details on that. But it's a really great question. And we have not really kind of dove into the weeds on that specifically for EIDT. I think of early childhood as all the programs, including EIDT. But we also know there might be some nuances there to consider. And so we want to be respectful of that. But it's a great question. We'll take that one and come back to you all to talk about how that might look. But I think at a high level, I would say, if there's a local lead in your area, get involved with that local lead work as soon as possible. Like reach out, or if they reach out to you, get to the table and be a part of those discussions, so that there is acknowledgement of the work that you're doing, the really important work that you're doing, and that we can think about the nuances and be respectful of that work. My next question is, what if I'm going to say early childhood program or Head Start receives state or federal funding? Is it required? Yes, it is all publicly funded programs. So I think we all know the answer to that. Generally speaking, that's any state or federal money that a program gets. Okay, I see a note there about resources and on-demand training. Thank you, Terry Helms, for putting that in. Art training activities can be found on the Child Care Aware site on a free app. So for those of you who are interested in that art integration, right there's your free information available to you. Can you expand on what this means and what it will entail for private programs, creating alignment among public-private providers and agencies? That is a fantastic question. So I do want to point out that in the LEARNS Act, there are several references, there's specific language about publicly funded programs. So if you're a private facility and you only take private pay parents, and I think you've heard our colleagues from Louisiana talk that they have people who are not publicly funded that are participating, because there might be funding available and opportunities available that you'd be interested in, and you wouldn't want to miss out on that by not participating. But right now, the way the law is written, there is some opportunity for you to identify someone who doesn't take public funding, and we have all that information. So we'll continue to monitor that. But I just want everyone, I've always been very, like all of our providers, we care about everybody. So I don't want anybody to feel like they're excluded, but there are some pieces in the law that are very specific to publicly funded.
And in Louisiana, that meant being open to taking children who are served through public funds. You don't necessarily have to have one in your center at the time of participation, but you had to be open to it and sign assurances that you were open to it, and be sort of authorized for public funds, whether or not you actually had someone in your program, because we know those populations are transient and they may come and go, and we weren't trying to change, what folks were eligible for as those populations changed.
Thank you, Nasha. I appreciate that clarification. So, I will point out that during the pandemic, we saw, programs that that normally take paying children lose a lot of that population as parents were working from home. So I just don't want you all to miss out on an opportunity, because if there was, let's say, for example, a philanthropic entity that wanted to fund early childhood in a community and to the local lead, and you decided not to participate, then everybody else could get funding for something and you'd be excluded. So think about it broadly, the way Nasha talked about it. If you're open to that possibility, consider the opportunity of partnering. And I just can't stress that enough. Just because maybe you aren't today doesn't mean you might not want to in the future. And by the way, there's a lot of discussion about children at higher incomes in the state, families that are slightly over the income that are not eligible for some of the programs that we have. So there may be funding available for more children and some of the children that you are serving, and you wouldn't want to miss that opportunity. No, Debbie, it will not take Arkansas. Family child care will be a part of our work from the beginning. And I think just learning from our Louisiana colleagues, we're not excluding family child care out. All of the programs in Arkansas that are licensed in the area will be included. Okay, I think that's Yeah, I appreciate Lori Bridges, who's been sending me this article. My wonderful colleague from Arkansas Better Chance put an article in. Encourage you all to read that. And then a question. Yes, they will be reaching out to all publicly funded local centers and all local centers just to give everybody an opportunity to be a part of the local leads work. So Cindy's question was, will the local leads who have been selected and are ready to start building relationships be reaching out to local centers, or will they focus only on federally funded? No, it's all publicly funded. So state pre-K, state and federal funding, Medicaid funded, so all of those. Yes, a community partnership definitely will be, but this is much broader than that. It is a much higher level thing. It's all of the early care and education programs in a community. They will be working to develop relationships with all and maybe private business. As we know, that's an important part of the consumers who use our services and who need that to be able to go to work. I'm going to shift here. Listen, we could spend, these ladies are wonderful, and we could spend all afternoon picking their brains and asking them questions. And they are not too far away from us, and I'm sure we'll be seeing their faces in the future. But I just want to give a big shout out to Amy and Lee and Tessa and Lemetris for the work that they're doing to serve children and families in their respective communities, and for giving their time today for us here in Arkansas. We're going to move on to our next slide. And we have a little bit of time to hear from Ashley Labetti, who is a colleague and external partner who is doing research on or evaluating our licensing regulations, which is also a part of the LEARNS Act. So Ashley, I'm going to turn it to you and let you talk about that work.
Perfect. Hey y'all, I'm Ashley. Thanks for the intro, Tanya. I'm actually going to share a couple slides. Not many, so give me 1 second. Okay. So first of all, hi, I'm Ashley. I lead an early childhood research and strategy practice called Pillars. This is our team. We're pretty babies, but everything we do is focused on early childhood. We've focused specifically in the past on licensing, and which is part of why we're working with y'all and Tanya and Dawn and OEC on this work. As a bit of context, Tanya mentioned the relationship between our work and the LEARNS Act, but this project specifically is a component under the LEARNS Act. So some of the direct language is mentioned here, but the Office of Education, Department of Education, Office of Early Childhood, in coordination with other state agencies, is required to, quote, reduce any burdensome, unnecessary rules for licensing of childcare facilities, and then write a report on the reduction of rules to the General Assembly. Our role is to write that report. We are doing research and both working really closely with OEC and looking kind of across states and talking with other experts in the field to kind of put together this research and analysis to meet this requirement. Part of the reason I'm here today is because a key source, in fact, the most important source of information for this analysis is providers' lived experiences. So our next step in this work is to engage directly with and incorporate input from early care and education providers in Arkansas, which hopefully will include all of y'all. There are two parts or two opportunities to engage or share your input into our analysis. One part is a provider survey. So we'll be sending this, I talk about next steps on the next slide, but you will receive a survey that is asking specifically about your experience with licensing. So we are looking to get input from the staff members, whomever that might be, who are responsible for ensuring that the provider of the ECE program is licensed. We want to really make sure that we are prioritizing partners across settings, age groups, geographies. We really want to make sure that we get input from a representative sample of providers so that we can incorporate everyone's opinion or experience. And again, we're focusing on your experience with licensing, and that includes areas of strength and areas of opportunities for growth. So this is, our hope is that we really can get authentic and experience-based input from the people who are most directly affected by licensing, as reflected by the people who are managing the process. So our next steps, or what this means for y'all, is that you'll receive an email with the provider survey this week. If you complete the survey, you'll be entered into a giveaway for a $30 gift card. And then as part of the survey, there's going to be an opportunity at the bottom where you can volunteer or say you're interested in participating in one of the focus groups. We're trying to be intentional about holding the focus groups at a range of different times to accommodate schedules. So before the day starts, during lunch, after the day ends, or in the evening time. So hopefully that will give people, time to, or be in people's free time. And because we're asking for your free time, we'll also compensate you for that. So there is so you'll also be compensated, or participants who engage in the focus groups will be compensated for their time. As part of the survey, the survey questions, it should take about 10 to 15 minutes to complete, and then the focus groups will be 60 minutes. Those are the goal here, again, is to deeply understand your lived experience with licensing. And that is, Tanya, is there anything that you would want to add?
I appreciate, I think here's an area that's can be a pain point. And if we don't hear from you, we won't know what that pain point is. I talk to providers, the ones who call me personally, and share something we can take care of. I can take care of that, but I always wonder how many people are sitting out there frustrated who didn't reach out. So here's an opportunity for you to share that lived experience, and we definitely want to make sure that we capture that. I will tell you that sometimes it's misunderstanding or miscommunication. Sometimes it's new staff at a facility, new staff here on our team, but there may be many things that I don't know about, and it's really important that we get this right. So we've been working with Ashley, but we really want to encourage you to participate so that we can make sure that if there are areas that we can address, that we do that. This is the opportunity. By the way, this is something that will be done on a 5-year frequency. So if we don't capture it today, in this first round, it's something that we'll be coming back around to. We have to review these regulations every 5 years. So if there's something that we miss, just know. And there may be laws that get passed and opportunities in between those 5 years where we will have to add something and change something. So it's not like it's the only time, but there is a process for promulgating rules in Arkansas, and it can take several months working with the legislature and making sure we get good public input, because everything we do has to go out for public comment. And so just know that as we begin to go through this process, we'll have to go through that public comment period. But I can't think of anything, Ashley, other than to just encourage them to participate, to take a moment to complete the survey if they can.
And this is one of it is just the most important source of information for this work. And so if you have time, I really would just encourage, I'm not quite on the level of begging just yet, but it really is, we really value your input, and want to make sure that we include everyone and as many people as we can. So if you have any questions, you can reach back out to the email address that you will send or that you'll receive the survey from. And someone on our team will answer you.
Thank you so much, Ashley, for being on. We're going to go ahead and go back to, and I believe Brandy Ishman on my team is going to talk about this. If not, I'll cover it, Brandy, but if you're on, I'd love to hand the mic over to you, dear.
Yes, ma'am. Good afternoon, everyone. We just wanted to make sure that everybody is aware that we have extended the essential worker authorizations until March 31st. No, there was a little conversation about where those were going to end. So we've gone back and we've looked at everything. All your authorizations either will be or have already been extended to March 31st. And I do want you to understand that this is the last extension that we're going to be doing for our last round of essential workers. Tanya.
Thanks, Brandy. So just for you all who may be aware, we were able to serve an additional 1,000, maybe 1,100 families, many of whom were in the impacted tornado areas, but it actually expanded beyond that, I think, over the summer. We reached capacity this fall, like we can't add anymore, but we can serve these families out through March 31st. That will exhaust the COVID relief funding that we've had here in the agency to serve families above our income guidelines. I will tell you, we've moved many families over into regular low income, especially people who work in our field, sadly, to access that. But the funding for those who are over will end on March 31st. I am going to just put a plug in here. This is not on the agenda, but we are actually working here in the Office of Early Childhood with our federal partners to do something that Kentucky has done similar, and it's related to this, but to really think about how we could expand childcare for the workforce, for providers who are serving voucher children in particular, and giving those staff an opportunity, even if they're above the income, only for early care and education. Let me clarify. This is not for essential workers. This is only for our field. Part of it is a workforce effort to support, because we know we have people who might be leaving our field to go teach and make more money, which is awesome for them. But we also want to provide some supports on our side. So we're working with federal partners. We'll announce that as we get approval, but it would in fact allow us to serve early care and education staff who might be over income requirements, who have a child that needs early care and education services. So we will announce that and announce the particulars as we get federally approved to do that. But I just want to let you guys know that's a big effort on our part and the staff's to make that happen for our workforce, because we really care about that. It's a great question. Any chance of extending the lifetime limit for vouchers for early childhood educators? Yes, you're referring to the 5-year or 60-month. Yes, thank you. Yes, we will probably be looking at that among all the other things. So thank you for pointing that out. We could definitely consider that. I'm not aware of insurance or fringe benefit grants for early care and education, but I will remind everyone that if you have employees that do not have health insurance, they can go out and apply for health insurance through the Arkansas Medicaid exchange. I just would encourage you to do that. Like, I know a lot of people who have been able to access healthcare benefits if they can't access them in the company that they work for. And yes, if we have any changes with that, we're only talking about extending it for early childhood. That was the question. So let me be clear. We're not talking about necessarily extending that for everyone. We currently allow students who are getting a degree or finishing up go beyond the 5 years, because we know if they're able to finish college, they're going to do better financially for their families. So we do have some allowances, but we're not talking about opening that up. I looked at that data years ago, and we had people who had been on it for 20 to 30 years because they had grandchildren, and we're not going there again, guys. We're going to give as many people an opportunity in this state to access childcare, and that's why we have that. We might look at the time frame and adjust that, But between all the programs and all the efforts that's getting ready to happen with the local leads, there's a lot of opportunity for children to be served. So we'll definitely take that. I see a great question, and I will get back with you, Risha, unless Dawn has an answer for that. It's about provider portal emails for ELS, Dawn. And I've had another question about that this week. So if you could put something in the chat box so that providers know how to access that. And then I know we have Lauren on from nutrition, and while I announced that team is over under Dr. Saunders, they're going to be on our calls as we go forward to make sure you all have updated information about health and nutrition. So Lauren, I'm going to hand it over and let you take it away.
All right, thank you so much. So good afternoon, everyone. I'm going to share with you guys my screen. I've got 2 quick little slides to go over with you all. However, we don't want to take up too much of your time. So we just wanted to give a quick application update for you all. I know a lot of you run daycare homes, and so this might not be relevant to you. You're going through a sponsor, but if you're involved in a daycare center, you're working at some sort of facility involved in childcare, we want to make sure you guys are all just aware of this application process. So the first thing that we wanted to share with you all is just what does the actual words on your application mean when it's at that pending submission time? So first is that if you see this approved or amended, this on your application, well, guess what? That means you're approved. So that means that what you have sent in as your application, you have the go ahead. It is complete. You might still be waiting to hear back from your application coordinator, but you're in a really good place. Your application also might just say pending approval. So what that means is that your application has been received from us. We got it. We are just waiting on your application coordinator to review it and to approve it, or to reach back out to you to ask follow-up questions or ask for some follow-up information. And then finally, if you see the words pending submission on your application, it means that your application either needs to be submitted or resubmitted. So there's one of 2 things that are going on there. If you see this pending submission, it does mean that there's something on your end that you need to do. So if you see this approved, amended, pending approval, you're good. You're just waiting on us. But if you see pending submission, that is your key that you need to get into that health and nutrition application and either submit it. For this application season, you might not have done that, or it might have been over the 30 days required to approve the application. So you might need to go in there and turn in some additional documents, complete some other pieces of info and get them sent our way so that you can turn that application in. So the other thing that we wanted to leave you guys here with just some tips for this application season. We know a lot of you have already turned in your application, but if you are still in that process, just 4 quick tips with you. First, if you're having any trouble with it, make sure to schedule an appointment with your application coordinator. So they always want to speak to you guys. Hopefully you know that they are there to help you. So schedule an appointment with them. That way it's on your calendar. Hey, that space is reserved so that they can speak to you. Then you want to make sure that you're up to date with your CACFP training. So both the CACFP refresher training and the new participant training are both available online and via YouTube. Those links are in our S&P resource library. You also then 3 want to make sure you have your documents completed, ready to upload, save them someplace on your computer, on whatever device you use where you know that they're at. You might even want to go back to your application from the year before and review the documents and forms that you turned in last year. And then finally, double check with that application coordinator before you submit to make sure, okay, are all my documents uploaded? Do they need anything else from me? Just so you can ensure that you have that smooth process of submitting everything. And that's really all we've got on this application side of things. You guys have been excellent turning in your application so far this year. But as always, reach out to us if we can help you guys in any way. Miss Irma, I see your comment as well. I'll get with you in just a moment. All right, thank you.
Thank you. Okay, I see a request for a link for information. If we can put the health nutrition link on there, guys, so that providers will have that. And I'm going to turn it over to Dawn.
Hey, good afternoon, everybody. So Tanya had mentioned earlier about making sure your curriculum is posted on your ELS portal, what the public facing. And if you don't know how to do that, if you just reach out to your specialist, We made a guide. It's just step by step. It doesn't take just a few steps and you're able to enter it. A lot of you are asking which email we pulled. So I opened up ELS to see what I see, which is what the public sees. It'll say facility email address. That is the one it is pulling. So when you go open on your side, just look, and it's whatever is associated with that facility. So, you know, make sure it is like the director or the owner, and it's not a board member, somebody that may not always check their email. And then you need to make sure you're trying to enter your enrollment. And that just helps us see if you're full or if you have an opening, and somebody may call us, or they may go on the public facing site, and then they can see if this place has any openings or not. So that's the two main things. But like Ashley said, we want the surveys to go to the right person. We want to hear your information. So just this afternoon, if you get a second, just open up on your side and look to make sure you have it on. It's the facility email address. That's where the email is pulled from.
Thanks, Dawn. And I'm thinking this is the closing slide. We're a little bit over today, gang, so I appreciate you for staying on and listening to our incredible colleagues down in Louisiana. The next call is December 5th at noon, so that'll be the first Tuesday of December. And if you have any ideas, or if you've heard something today that you'd like to have follow-up on, you can send that to me or Dawn, or any of the OEC staff, and we can try to prioritize those and make sure that we're covering information that's helpful for y'all. I do want to share something that I noticed, and I don't know if the rest of you are paying attention to this, but we've been doing this call since really, I don't know, May maybe of 2020, right after the pandemic started. We started it back then, and we were doing it weekly, frankly, at the beginning, and then we've moved to monthly now. But the number of people on this call today, so I want two things that you need to know about. First of all, we have changed our Zoom calls. Our channels are now over at the Department of Ed, and we have 3, but our previous one had space for 1,000. We never had 1,000 on. But our new one only has space for 300. So I am certain you've had some colleagues, if you've been watching the chat or the participants, we've been up to 300 several times. People have hopped on, but we've had people in the wait list. So please, if you have colleagues that couldn't get in, it's because we only have space for 300. These calls are recorded and posted on the OEC website under, I think it's important COVID-related information. We're going to change that soon and just put provider Zoom call. I think we can scratch the COVID thing at this point. Not that it's not around us and in the air every day these days, but just because it might be, you guys might be able to find it better if we do change that. But we had put it there when we first started as part of our COVID information, and so we've kept it there. But it will be recorded. There is the link from Kayla Bodie. Thank you, Kayla. I did share the current local leads. It will be a part of this call, and it should be on our LEARNS website, but happy to share that with you, Ms. Jones, who those 12 that were named for this first cohort. And remember, this is just the first cohort. The last thing I want to share is, if you are calling the Office of Early Childhood, for those of us here at DHS, we are on the DHS network. It's all very complicated IT stuff, guys, and I'm not the expert, but here's what I can tell you. If you are calling by phone and someone doesn't answer your call and you leave a voicemail, it is going into some place that we will never find it. I don't know where. Maybe we're going to find them someday and we'll have all these. Sometimes I find missed calls in my junk email, and I don't check my junk email every day, guys, because I barely have time to read all the emails that are in my inbox that get through to me. But if you are trying to reach anybody on the OEC team, the best way to do it right now is to send an email. If you are calling and you leave a message, it is likely my staff will not get it. And I'm just trying to get that out to the universe so everyone knows that. Send an email and let them know, hey, I called you. You may not have seen the call, but I'm needing this. And that way the emails are getting through. The emails do come through. It's the phone calls that are going someplace, and it's because we're on 2 servers and it's very complicated, but it's going to change eventually when we get physically moved, but that's probably several months away. So in the meantime, if you can email, I think you will be able to help you. And if you have a work cell, you know, you can reach us. Mine is 501. This is my work cell. Please don't call me after midnight. I try to go to bed and get rest. I drive from Russellville every day and I need to be alert, but 501-944-9650 is my work cell. And I will not answer if I'm in a meeting or on a call. I think it's very rude to do that. But if it's an emergency, just say I have an emergency. But we will try to be as responsive as we can. But I am seeing that. And I just want you all to know it's not that anybody's ignoring, it's that we literally are not getting those calls unless we're in the chair at the phone answering at the time you call. And sometimes we have to take restroom breaks. So just wanted you guys to be aware of that. Thank you guys so much. I'm really excited to see how many people are on this call today. And I may have to ask the department for extended Zoom capacity if we keep this up, but appreciate you all and everything you're doing to take care of kiddos every single day. Take care, enjoy the holiday that's upcoming, and we'll see you before the next holiday. So see you next time.